Good morning, everybody. I hope you are doing fantastic. I have my handy dandy pouty assistant here with me this morning, Miss Tater Tot. She got in some trouble this morning, so she's on a timeout sitting here with Dad. So, this morning, what we are going to talk about is actually a super cool finding, or let's say happening, that occurs with use with hyperbaric. And I'm also going to get into more of it later. Yes, I know you're here, Taters. You don't have to scratch me. So let's kick it off. It is dealing with inflammation and hyperbaric oxygen therapy. So inflammation is an integral finding in numerous medical conditions, and it coincides with nearly all types of injuries. And some people like to call it insults to the body, so potato there. Numerous studies have reported chronic inflammation in Alzheimer's disease, autism, cancer, stroke, diabetes, traumatic brain injury, and many other chronic health conditions, as well as like your acute injuries. Say you're playing football, soccer, lacrosse, and you blow out your knee. Hyperbaric oxygen therapy, or as we like to call it, HBOT, has been demonstrated to substantially reduce inflammation throughout the body, which in the case of an injury is going to help reduce your pain. We have more on that here in a minute. HBOT helps drive increased levels of oxygen into the body while you're under pressure, which allows it to travel 2 to 4 times further. This oxygen travels in your plasma and subsequently helps reduce your inflammation and pain. Studies have shown that HBOT increases your anti-inflammatory levels and provides increased cellular aid to help heal your targeted regions. As oxygen serves as one of the primary mechanisms to help reduce inflammation, HBOT helps create an oxygen-rich environment, and it is stimulated and enhanced. So, as if that isn't enough, I am going to put Miss Tater Tot down here in 1 second. Hop off there, kid. Go to your chair. If that wasn't enough, we also have some other really cool tools to help reduce inflammation. This here, I'm just getting it kicked on. Takes a hot second here to fire up. And we'll just turn the camera around right now. It does not like me rotating the phone. This beast here is our Class 4 laser. Very powerful, super deep penetration, and it helps to, you ready for it? Dilate your injured areas, which will then in turn helps allow more oxygen into the area, which will help reduce your pain, like we talked about with the HBOT. So a very, very, very powerful 1-2 combo is to use the Class 4 laser, or I even forgot about these guys just because I haven't plugged them in yet this morning, or put them up on their stands, are the Class 2 lasers. So those Erconias also, again, allow us to target or spot treat an area, or we could even say we could shoot the brain to help enhance the mitochondrial function up there and then put you into the hyperbaric chamber. So we're already stimulating it with the red light, or in the case of the EVRL, the red and violet light, so half the treatment time using that laser, and then putting you into an oxygen-rich environment, which will help you get better quicker. I am going to do one last flip on the camera here, and then we've got this beast, the Magnetolith. It does some really cool stuff. I did a video on it, a couple of years ago. The gist of that device is it is super awesome, and it's way too much to cover in one of these quick shorts. So if you guys and gals have any questions or comments, feel free to reach out to myself or the ever cute Miss Tater Tot. or Dr. Gillen. And realistically, I will get back to you as soon as I see you post a comment or question on social media. It's just a delayed response. They don't always show up on our end, sometimes for a couple days, but we do keep our eyes peeled for them, and I will answer them as soon as I see them. Have a great day, Kalispell. See ya.